If you want to know the diets that are going to be on your NCLEX and you want me to simplify it for you, watch this until the you like, save, share this out. I'll tell you exactly what you need to know. No more, no less, no fluff. Let's go. NCLEX diets are not just about trends for the NCLEX. It's about protecting organ, preventing complication. Number one thing the NCLEX wants you to know is to prevent complications. You know the Patho, the answer becomes obvious. Today, I'm going to go over the 3 that the NCLEX loves to test on. The first one is your keto diet. This is the one that the NCLEX likes to trap you on because it is high fat and very low carb, because that will make the body burn fat faster and have ketosis. Patho behind it is if you have low carb, this decreases insulin, causes fat breakdown, which causes ketones and acidic blood risk. Should not be on a keto diet. Someone with type 1 diabetes, DKA risk, kidney disease, pregnancy. If the question mentions something like ketones, diabetes, kidney issues, dehydration, keto is not the safe diet. Keto diet is rarely the right answer. But type 2 diabetics can be on a keto diet. They have obesity or they have a metabolic disorder. They can be on a keto diet for short term. Just make sure that you know keto is really not recommended on the NCLEX. The next diet that's highly tested on is your low sodium cardiac diet for your heart failure and your hypertensive patients. This prevents fluid retention, which then decreases the cardiac workload. Patho is sodium makes water follow it. So it increases the preload, which worsens heart failure and edema. If you see on the NCLEX heart failure, hypertension, edema, I want you to think low sodium. Obviously going to go with anything baked, any vegetables, and anything that is not salted. Processed, canned, cured food is very high in sodium. Fresh foods are always the safest. The next diet is your renal diet. This is when they have chronic kidney disease. The restrictions are low protein, low potassium, low phosphorus, and low sodium. Take it easy on the kidneys. They cannot filter all of that. Failing kidneys not excrete any electrolytes. So it causes things like hyperkalemia, which can then cause deadly arrhythmias. So if the potassium is high, dangerous in renal failure. Let's wrap this all up. Keto plus diabetes type 1 is DKA risk. Heart failure is always low sodium. Kidney failure, remember potassium. Processed foods is an NCLEX red flag and never choose it. And the Patho tell you the answer. Because if you know how the body works, you know how to critically think and answer the questions, and that just becomes so much easier on the NCLEX. If you like my teaching, you want more information just like this, go grab Simply NCLEX at the top of my page. Please make sure you like, save, share this video out to help somebody else out, and happy studying.